When COAG meets tomorrow, the former Australian of the Year, Professor Patrick McGorry, will tell the Prime Minister and State Premiers what he thinks should be done for mental health in Australia. In May, after warnings Australia was dangerously under-investing in the sector and pressure from the opposition, the federal government boosted funding by $1.5 billion over 5 years, on top of $600 million announced last year. But Professor McGorry's position is not without its critics. Hamish Fitzsimmons reports from Melbourne.
When Professor Patrick McGorry was made Australian of the Year in 2010, it was clear he'd be putting mental health funding on the political agenda.
People's lives are at risk. There's a whole generation of young people who are still being locked out of mental health care because of the underinvestment in that area of reform.
When there was a boost for mental health funding in the May budget, many put it down to the tenacity of people like Professor McGorry and John Mendoza, the former chairman of the National Advisory Council on Mental Health. But Professor Mendoza says the so-called boost has been massively overstated.
The size of the investment from the Commonwealth Government in the May budget is very modest. The new money that's contained in the $2.2 billion actually is only just over $100 million per year. So the bulk of the money is actually redirected.
He says the sector remains in a state of crisis and areas that most need funding, early intervention and youth services, continue to struggle.
All of these services say they are overwhelmed with demand, unable to actually operate as intended.
And there are criticisms of how funding is actually being directed. Professor John Giuradini from the University of Adelaide says there's been too much emphasis on the areas championed by Professor McGorry, such as Headspace and early psychosis prevention and intervention centres known as EPIC.
Unfortunately, I think that his enthusiasm for what he's doing sometimes gets in front of the evidence. And what concerns me is that we're over-investing in one particular approach that is credible but doesn't have a strong evidence base.
John Mendoza disagrees.
It's in that age up to 25, we've had no service system. And so investment in Headspace services, which is effectively the joined-up primary care service, and the early psychosis services, has been, if you like, the most important investment that we could make at this time, given the other priorities we've got across the system.
One of the key issues being debated in the area of the young and mental illness currently is the high proportion of intervention and the wisdom of using medications on young people that have potentially harmful side effects.
Professor McGorry is saying that he has no interest in medicating young people who haven't yet become psychotic, but research continues in this area, and it's not at all clear that EPIC isn't going to take on people before they become psychotic. And I think we really need some clarification about that, because many of us have concerns about the dangers of instituting conventional psychiatric treatment too early.
Professor Giuradini is also critical of the way Professors McGorry and Mendoza have used statistics to support arguments for funding some areas over others.
I think that they've been very loose in their use of statistics, and when many people have challenged them over this, and their response has unfortunately been often to attack the person who's made the criticism rather than addressing the scientific issue at hand.
I reject entirely that we've championed any one part. We have consistently said that the spectrum of mental health services needs to be increased in funding.
Former Mental Health Council Chief David Crosby says the criticisms of people like John Mendoza and Pat McGorry reflect infighting from a sector suffering from years of underfunding.
Many people in the mental health sector are really struggling. They're trying to make do with inadequate resources, and when they see someone else in the mental health sector actually get some resources, it becomes kind of an envy and a kind of, that should be our resources.
At the COAG meeting, Pat McGorry will spell out his vision for an overhaul of mental health care in Australia. Hamish Fitzsimmons, Lateline.